Hello everyone, welcome to the ENT corridor. So from today onwards, we are going to discuss a very important topic that is nothing but anatomy of larynx. It is very important for UGs as well as PGs. Okay, and it's a very huge topic. So we are going to discuss in 4 to 5 parts. So today we are going to carry out with part one, in which we are going to discuss the introduction and embryology of larynx. Okay, so I just want to give you a brief outline. Okay, how does a larynx look? Okay, this is the anterior view of the larynx. Okay, as you can see here, this is the posterior view of the larynx, and this is the sagittal view of the larynx. Okay, we'll come into detail how does this look like, but a brief introduction. The thing over here, this is the epiglottis. Okay, this is the epiglottis. This is the hyoid bone. This is the thyroid cartilage. This is the cricoid cartilage, and this whole thing is the tracheal rings. Okay, so first let us start with the introduction of larynx. Okay, talking about the introduction, it is a musculocartilaginous or musculoligamentous structure. Okay, lined by the mucous membrane. It is connected with the pharynx as well as the trachea, and the whole extent is from C3 to C6. Okay, and the larynx is further divided into three parts. This is very important because in Viva you will be asked what are the parts of the larynx. So we have it to be like supraglottis, glottis, and the subglottis. Okay. Now the next thing which they ask in Viva is what are the things that come under the supraglottis, the glottis, and the subglottis. Okay. In supraglottis, we have epiglottis, the aeroepiglottic fold, the false vocal cord, and the arytenoid cartilage. Okay, and in the glottis, we have the true vocal cords and the anterior and the posterior commissure. And in subglottis, which is nothing but below the vocal cords, it is called as the subglottis. Okay, now another thing which is important is what are the functions? Okay, the supraglottis, it protects the airway, the glottis is for phonation, and the subglottis is nothing but the narrowest part. It is very important. The narrowest part of the larynx. Okay, so you need to know about the parts of larynx, which is divided into supraglottis, glottis, and subglottis. Now, what are the contents of the supraglottis, or what are the components of the supraglottis? We have the epiglottis, aeroepiglottic fold, false vocal cord, and the arytenoid, which we'll see later on what are these all. I just want to remember, okay, what are the things that come inside this. And in glottis, we have the true vocal cords, the anterior and the posterior commissure, and in subglottis, it is the area below the vocal cords. Okay, so when we talk about the phonation, we say that larynx is responsible for phonation. Okay, but this phonating system has two things, which is nothing but the resonating system and an articulating system. Okay, so what comprises of the resonating system? We have the pharynx, then we have the nose, then we have the sinuses. Okay, these three, they all combined together, they form the resonating system. And when we talk about the articulating system, we have the tongue, we have the soft palate, and then we have the lips. I think this is quite evident. We do not need any kind of deep explanation into this. Now, quickly let us see about the embryology. Okay, so we know, as we have seen in anatomy of tympanic membrane, it all started with the pharyngeal arches, right? So this diagram is very important. Okay, the development of larynx takes place from the splanchnic mesoderm. You can see this splanchnic mesoderm. It is nothing but it is a mesoderm that is covering the foregut. Okay, so if you see this diagram, this is a developing embryo. Okay, this is a developing embryo. Okay, and you have a respiratory bud. I have marked over here. You have a respiratory bud over here. This whole thing is nothing but the foregut, and this is your digestive tract. Okay, and I have enlarged this much portion. Okay, so this is nothing but the foregut section. The foregut surrounding the red thing which you can see, it is the splanchnic mesoderm, and this is the inner endoderm. Okay, so the larynx develops as an outpouching. Okay, it develops like a small bud. You can see the small bud. Okay, small bud from the splanchnic mesoderm, and you have two ends. We have the cranial end and then we have the caudal end, right? So this will develop downward. This will grow downwards. As you can see over here, it is growing downwards, and posteriorly what is developing, we have the esophagus. That's why we say that the larynx is connected. Okay, the larynx is connected with the esophagus, right? So as you can see over here, it is growing downwards towards the caudal end and not towards the cranial end. And slowly, as it grows downwards, it develops further into two buds, which are called as this bronchial buds. Okay. So first we have the development of the larynx, then we have the development of this bronchial tree. Okay. Then we have the development of this bronchial tree, and further it leads to the development of the lung. Okay. This is when you're seeing through the front view. If you see from a top view, as you can see here, this is the esophagus. Okay, this is your laryngeal bud. Okay, and there is a small communication. If you see, there is a small communication over here. Okay, this communication is quite intact, and there is a name for this communication which is called as furcula of His. Okay, this is a communication which is patent between the primitive gut as well as the laryngeal inlet. Okay, that is called as the furcula of His. And if I show you in another section, you can see this. Okay, this is also a developing embryo. You can see there is development of this pharyngeal arches, and this is a heart over here, and this pharyngeal arches. Can you see? Let's focus on this lower section. Okay, here you can see there is esophagus that is developing over here. This portion is nothing but the esophagus, and if you see, this is the diverticulum that has been grown outside, which is developing downwards. Okay, now you can get a basic orientation. Now we'll again see, we have opened this pharyngeal arches over here. Okay, we have opened the pharyngeal arches. This is the first arch, second arch, third arch, fourth arch, and the fifth arch. Okay, as you all know, these are the lingual swellings, and then we have the foramen cecum over here. Okay, this violet color is nothing but the hypobronchial eminence. Then below that we have the epiglottic swelling, and this portion, there is a slit like shaped portion which is called a laryngeotracheal groove. Okay, so this leads to the development of this larynx. Okay, the larynx is developing over here, and as you can see, this is a slit like development. Above we have the epiglottis, and at the sides, okay, if you see at the side, this fourth and sixth, okay, if you see at the side, the mesenchyme of the fourth and the sixth arch, it proliferates to form the arytenoid cartilage. You can see this arytenoid cartilage, arytenoid swelling. So how does this arytenoid swelling come from? From the fourth and the sixth arch mesenchyme, they proliferate to form this arytenoid swelling. Okay, initially this slit like opening is like this. Okay, this is like a I shape. You can call it an I shape, and slowly what happens, it gets converted into U shape, as you can see, and further it will get converted into T shape. Okay, slowly this is how the laryngeal inlet, it takes its shape. Okay, so I'm just quickly going through whatever the whole PDF is about the embryology. So around the fourth intrauterine life, what happens is the development starts from this splanchnopleuric mesoderm surrounding the foregut. Okay, diverticulum called as respiratory diverticulum or laryngeotracheal diverticulum. It grows downwards and forms the trachea and the lungs. We discussed about it. But a small communication remains between the primitive gut, which is known as furcula of His. I already talked about it. Presents like a slit-like orifice, which is called as laryngeal inlet. So this is basically the laryngeal inlet, which we talked about. Okay. Now, cranially, we have the hypobronchial eminence. We talked about this hypobronchial eminence. Okay. And the epiglottic swelling. We also saw the epiglottic swelling. Okay. And laterally, as I told, laterally, this fourth and sixth mesenchymal, it proliferates and it forms the arytenoid cartilage. Okay. And initially, it is slit shape, but later on, it gets converted into a T shape. So, what's the basic summary? If somebody asks, Okay, where is the epiglottis developing from? So it develops from this hyperbronchial eminence. There is an epiglottic swelling. Then the thyroid cartilage, it develops from this fourth arch, and from the sixth arch we have arytenoid, corniculate, cricoid, and tracheal cartilages are developing from it. Okay, so this is just the part one. Now for further videos